Good morning, Elevation Health family and friends, and a happy Tuesday. It is Tuesday, May 13th. We're in the middle of May, and first thing I wanted to do is just wish a happy birthday. We've got several family members who are celebrating birthdays in the month of May. David Lamont, Teresa Bram, Rabia Satar, Pulak Debnath, Evelyn Parkin, Brenda Davis, Linda Wisniewski, Justin Thomas, Veronica Johnson, Vivette Blackwood, Natalia Martinez, Audrey Allen, Giuseppe Colangelo, Dudley Allen, Hyacinth Miller, and Pauline Simpson, all celebrating birthdays in this marvelous month of May. So we love you and appreciate you and trust that you are a year older, but as a result of all your chiropractic care, better nerve supply, a healthier nerve system, you're a year older, but you're a year healthier. Your spine is a year stronger. And that's what our goal always is. You know, just got done exercising, getting some blood to my body and my brain, and I was thinking about the message this morning and what's important to me because I want what's best for you. If you're a patient under my care, I believe that there's two types of patients. And through this message, I'm hoping you'll be able to answer this question. Which type of patient are you? One type of patient comes in and wants to get fixed. In other words, I hurt here, I hurt down here. You got it last time, with that adjustment, you were able to get there and crack it, move it, put it back in place. But it just feels like it needs it again. If you know where I'm going with this, that would be kind of like taking your car to a mechanic after you've watched a bunch of YouTube videos showing you what you are hoping to get the answer to your problem is. You take all this information and then you go to the mechanic and you tell the mechanic what's wrong, what you want done, and how do you think that mechanic is going to respond? Or listening to that, how do you think that encounter is going to go? So when I hear that, when somebody comes in and tells me to do this and do that, my first response is that of compassion and empathy. Obviously, if you're in pain, obviously I've had my share of that, and I don't take that lightly. You're in the office, I want to help. However, it's important to be realistic and remember that the adjustments don't do the healing. We've all been trained and brainwashed as we've grown up to, take a pain or an ailment and treat it and fix it with a drug, a shot, a pill, potion, lotion. And that's what doctors generally do. Contemporary allopathic medical approach is to treat the problem, eradicate the problem, and fix the problem. The problem is, for chiropractic, for our approach, for me, is that you can't do that with an adjustment. There's no such thing as cracking a bone back into place. That doesn't happen realistically. And I've got literally 30 years of postgraduate ongoing education with the latest scientific evidence, peer-reviewed, published journals where the information clearly shows you cannot crack a bone and move it back in place. The postural muscles are what move the bones. And over time and repetition, through a process of structural correction, we can see an evidence-based outcome. But really what happens with one adjustment at a time is you're moving the spine in the right direction. You're teaching your body, where the bone should be, but it's not like it goes there and stays there. We're opening up the joints, we're taking pressure off the nerves, and through a neurological response, we're creating a pathway for your body to adapt and heal a little more efficiently. And when I say a little, that's actually an understatement, to be honest with you. because I have full faith that nobody gets off a table in our office without functioning and healing better after an adjustment. Now, that doesn't mean that your pain goes away immediately. Sometimes you feel an improvement. Sometimes, you notice it as time goes on. But nonetheless, I am not in control of your healing or anybody's healing. The healing happens after you get up off the table. The healing happens between one adjustment and the next. There is no healing in the moment of that adjustment. You may have heard me say this before. I move the bone and God does the healing. You already walk into the office with the greatest healing power inside of you. It's already there. My job is to remove the interference to that. So that's different from an allopathic approach and trying to treat and cure and fix something. Hopefully that makes sense. The chiropractic approach is vitalistic, which means we don't treat or cure or heal anything. We remove the interference to allow the power that made your body to heal your body. And I know that you've heard that before. And this is a message of encouragement for me. It's a reminder for me of why I have such passion for what I do, because God is my co-pilot. And knowing that, that it doesn't matter if a person has pain, sickness, or disease, or they're well, you can only do better by having your spine checked and removing whatever interference is there. You can only be healthier and function better and heal better after an adjustment. I'll give you an example. My father, some of you guys know this story, dove into a lake, hit a cast iron tub with his head, shifted his atlas, the top bone, out of alignment, and he was unconscious for a couple of weeks. He woke up, and because the atlas stayed out of alignment and the doctors never found the cause of the problem, he was just medicated. This went on for decades. Still had chronic migraines every single day. And it wasn't until I went to chiropractic school that I actually found the cause of those migraine headaches. And with one adjustment, I shifted the bone. I put some pressure here. I unlocked that joint, and immediately he felt relief. Now, that wasn't his last adjustment. Through a series of adjustments over the course of days and weeks and the next several months, he was able to reduce and get off his medications. And I don't know how many decades ago that was, probably a good 35 years ago, he can count the number of headaches he's had on his left hand. But the greatest benefit that my father has seen from staying under regular maintenance care isn't just, being headache free. The most important, impactful thing that I've recognized, that everybody in our immediate family has recognized, is that he was able to get off his medications. Because he got off his medications, his body chemistry was more normal. He became a happier person. His relationships improved. He started to travel with my mother. I mean, the results, the improvements, the performance in his health and his social life and his emotional well-being is just unquantifiable. And honestly, this is the greatest thing that I've seen about chiropractic, being able to help individuals like my father, and many of you have seen, that as time goes on, the healing doesn't stop. Your body is always healing. It's always looking for ways to adapt and be more efficient in terms of that adaptation to stress and its environment. And the question is, what percent do you want your nervous system to be functioning at? How many of you watching this video right now want to be 100% of your God-given potential? All of us. And that is the most important reason for you to be coming in for your next appointment, for you to be laying on that table and waiting to get checked, to see that I can find and remove the interference from what's stopping you at performing at your best, for you to be the best version of yourself, expressing 100%, being fully human. That's the value of a chiropractic adjustment and what it can do for your health and your life. One more story and then I'll finish. This was probably in the early 90s when I first opened my practice. And again, I saw what an atlas adjustment can do. Somebody walked into my office and said, Dr. Yachter, I was shopping in the plaza here. Somebody told me to come in and see if you could help me. My 5-year-old daughter ran out into the street after a ball and was hit by a car. She was launched into the air about 20 feet, came down on her head, and she's been in a coma ever since. And this happened about 2 weeks before she came into the office. So I said, where is she? She said she's up the street at Health South. And we actually live in Naples. I drove over because this was the best facility that they had in terms of for best hope for rehabilitation. So is there anything that you can do? I said, well, let's check it out. So I went over there, and there she was. She was comatose, laying in the bed. And I took my little instrument, my adjusting instrument, and I went over and I felt her atlas, the top bone in the neck. And I felt that it was locked up. It wasn't moving properly. And I could feel it. I could sense it. It was very cold on one side. It was very obvious where she needed to be adjusted. And I put my instrument on there, and I clicked away, gave it an adjustment, and I stepped back from the bed. And I said, that's it. My job is done. If you would like, I'll come back tomorrow. She said, yes, please do. Well, make a long story short, woke up the next day, and I called the mother. And I said, how's Allie doing? And she couldn't get the words out. She was weeping. She was hysterically weeping, crying. She couldn't get the words out to tell me. She said Allie woke up. She said she woke up in the middle of the night, and she was screaming, Mommy, Mommy, Mommy. And she was moving her hands, and she was moving her body, and she was awake. She was alert. She came out of the coma. And the mother told me, she said, it's a miracle. She said, I know what you did helped. Please come back today. And I went back there, and I gave her another adjustment, and I did that for several days in a row. By the end of the week, the last time I went over, the last thing that I remember is they were wheeling her out of the facility into a car to take her home. Now, I don't say that to impress you again. I don't do the healing, but I want you to understand the power of one atlas adjustment. Forget about your lower back, forget about your mid back, forget about your pain. What does an atlas adjustment do? If it can do something like that for my father or a little girl who's in a coma, you never know how far reaching, what the effect of proper nerve supply is going to do in somebody's body, whether you're healing or not. And that's my job, to find and remove any interference from what's stopping you from being at your best. Now, I've had many of these incidents and stories all across my career, and I could tell you many more of them, but I'm not going to take up any more of your time. I just wanted to make that point. What kind of patient are you? Which type of patient are you? You know, again, the one type uses chiropractic care like a pill or a potion in a medical allopathic fashion to fix something, which many chiropractors do, but that's not my approach. And the other chiropractor is to analyze and correct any interference that would be stopping anybody from functioning and healing at their God-given best, regardless of their pain or their condition, to find and correct the cause of sickness and disease, ideally before it has a chance to develop. Which type of patient are you? So I'll let you answer that question. Listen, either way, I love and appreciate you. I appreciate the opportunity to take care of you. I'm always going to give you 110%, and I know that you're doing the same. So thank you so much for joining me today. I love and appreciate you. God bless.